My name is Misty Anderson. I want to share my mom's story, and my story is her daughter watching. Her name is Becky Barnett. She was diagnosed with breast cancer when she was 26 years old. She's a 45-year survivor. She was a young, married, working mother of 2 small children when she realized she had a lump in her breast. This was in the 1970s. Back then, you whispered breast cancer, and the primary treatment option was a radical mastectomy. Breast cancer wasn't really discussed, prevention and screening wasn't discussed, and there weren't any support groups at that time. Disease awareness was slowly just beginning. Breast cancer had been around for a while, but history reports that this time was when it began to be discussed. This is when you really started hearing people trying to get it out in healthcare. I don't remember much about the time of her diagnosis and surgeries, just that she was in and out of the hospital several times, and my brother and I stayed with grandparents and with aunts and uncles a lot. We were very young. It wasn't until I was older, as a teenager, and able to understand, that my mom explained to me about her diagnosis, the treatment, and that she was in remission. I remember that day well. I cried. It was very scary to think about what she had been diagnosed and had battled. A lot of fear, but she had already fought the big fight and had won. As I got older into college and through nursing school and had a daughter of my own, my mom had breast cancer. Has always stayed attached to me and my family. So much pride when I look at what a strong woman she was and is, but also the women in our family always wondered if it was a genetic, would my aunts, my cousins, my daughter, or myself face this same thing one day. In my lifetime, genetic testing for breast cancer genes has been developed. These tests don't mean we won't get breast cancer if we don't have the gene, but it does give us some peace of mind, knowing that my mom doesn't carry any of those genes. Look how far we have grown as a society and in healthcare related to breast cancer. We no longer whisper that a woman or a man has breast cancer, and we no longer have only one recommended option for treatment. We now immediately give those with a breast cancer diagnosis options for care and treatment, for their resources, and emotional support. I am so proud of my mom when I think about how strong she was and of all the times that she has spoken to women about what she went through and has given them support. She gives all the glory to God. I want to finish up by saying thank you to healthcare for growing and becoming cutting edge with technology and with heart.